One of the topics that people may often find uncomfortable to talk about is regarding menstruation or period. It could be because of fear of being judged by others or being seen as weak or incapable, or it could also be because it is made into a taboo topic. How will a young girl explain to her friends why she is missing out on her classes? Or how will you ask your boss for another day of leave? Or what do you do when every single month, for a few days, you do not feel like leaving your house or even getting out of your bed? Is this normal? What causes it? And how can you handle this pain? In this video, let us discuss all about it. Namaste, I'm Dr. Tejaswini and welcome to Best of Homeopathy. Dysmenorrhea is the medical term for describing the pain experienced during period or the cramping. In addition to cramping, there can also be weakness, nausea or actual vomiting, diarrhea, and also coldness of palms and feet. The girl may even faint. Mild to moderate cramping is always normal, but in some women, the pain can be so severe that doing daily routine activities like walking, going to school, working out, or reading, or doing any other activity which they actually enjoy also will be difficult. Now, there are two types of dysmenorrhea. You have primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea is the one where you do not actually have any problems concerning the female reproductive organs. It is a kind of pain which comes on either on the day of menstruation or 1 or 2 days before. The pain, which is in the form of cramps, comes back every time you have your period, and also it can be felt in your lower abdomen, back, or even thighs. So why does it pain so much if there is no actual problem with the uterus or other female organs? During the menstrual period, as you know, blood along with the inner lining of the uterus is shed out. And in order to do this, the muscles of the uterus squeeze tightly. And it is this squeezing or tightening of the muscles which is felt as the period cramp or pain. Also, if the woman has excessive bleeding or she has developed clots, then she experiences more pain as the uterus contracts even more to shed all these out. So naturally, when the clot is passed, she feels some kind of relief. Now, the other kind of dysmenorrhea is the secondary dysmenorrhea, which is also called as congestive dysmenorrhea. This kind is usually not experienced by younger girls or teenagers. However, women in their late 20s or 30s or above may experience this. And this kind of dysmenorrhea develops only when there is some abnormality in the uterus or the other female organs. Here, the pain usually begins 3 to 4 days before the actual menstruation, and once the bleeding begins, the pain only increases and may not even come down. Along with the pain, the women can also experience excessive or heavy bleeding, spotting throughout the month, or pain throughout the month. So all these indicate that there is some abnormality or problem within the uterus and it needs to be investigated. There are several reasons to develop this secondary type of dysmenorrhea. Some are more common than the others. Few of them include fibroid uterus, which is actually a non-cancerous growth which develops within the uterus, and the pain comes out because the uterus feels that it is a foreign object and that it has to be pushed out of the body. That is why there will be more cramping. The second reason is endometriosis. So in this condition, the inner lining of the uterus, which is always shed out during the period, begins to grow even outside the uterus. It could be within the walls of the uterus, that is within the muscles. It could also be in the ovaries or the fallopian tubes, cervix, or even inside the abdomen. During period, every month, as the inner lining is shed out from the women, all these other parts also begin to bleed, and that is why there can be severe pain. Few other conditions include adenomyosis, which is very similar to endometriosis, where the inner lining is present within the wall of the uterus itself. And then you have pelvic inflammatory disease, which is nothing but infections which begin, mostly bacterial, which begins in the uterus and then spreads. Now, treating painful periods really depends on the cause behind it. While primary dysmenorrhea may respond very well to anti-pain medications, secondary dysmenorrhea may not benefit from it at all. Unless the cause behind the secondary dysmenorrhea is discovered and treated, the pain remains. Homeopathy offers a great range of medicines which can come to your rescue. Remedies like Chamomilla, Viburnum opulus, Veratrum album, Actia racemosa, Mac Fos, Colocynth, and many others provide almost immediate relief from the pain, but the selection of the remedy can be done only by your doctor after determining the cause behind your pain. Some of the ways in which you can find some kind of relief at home is by placing a hot water bag on your abdomen, but please see to it that you place it over your clothes and not directly touching it to your skin, as it can lead to mild burns. Also, it is found to be very effective to do some kind of stretching during periods. It is very understandable that it may be even difficult to stand up during the severe pain, but try to just walk around in your room even if you don't want to go outside. It kind of diverts your mind away from the pain. And the last one, which is very important, is to keep yourself hydrated. It would definitely help in bringing down the pain. Please do not ignore or feel embarrassed to seek out medical help if you are in need. It is true that every woman goes through it at some point in their life, but that does not mean that you need to suffer through it. If you're looking for homeopathy consultation, then you can definitely book your appointment with us. The link is provided in the description. Thank you.